Crowdsourcing. It's the practice of obtaining participants, services, ideas, or content by soliciting contributions from a large group of people. Crowdsourcing is not a new concept. One of the earliest documented crowdsourcing efforts was a piece of legislation passed by the British government in 1714, offering a reward for anyone producing a simple method to determine the longitude of a ship. Crowdsourcing is a concept that has gained popularity since the advent of the internet, and in particular, Web 2.0. So how can crowdsourcing be used in clinical trials? Clinical trials are highly controlled studies used to answer very specific questions. How can this big messy world of public contribution help? To answer this, we need to talk about Kevin. This is Kevin. Kevin has just been to the doctor, who has prescribed some shiny new green pills for Kevin's ailment. Kevin goes home and starts to take his tablets. Since Kevin's trip to the doctor, he hasn't been feeling so good. So what does Kevin do? Well, like 74% of adults, Kevin is a user of the internet. And like 80% of internet users, Kevin goes online to find health information. Kevin finds a health forum and asks the community what their experiences of this medication have been. Do they match his own? And the answers start to roll in. Some people have experienced the same thing, some not so much. Kevin finds more opinions, questions, random noise, and more. And Kevin finds more people doing the same thing that he had done, asking questions and sharing experiences. People all over the world with every disease, ailment, and complaint known to man are repeating this behaviour. Social networks, disease-specific groups, and the rise of citizen science and self-experimentation are creating a wealth of data. So how are researchers harnessing this information? Can it be used to answer specific research questions? One of the best-known studies to utilise crowdsourcing in an interventional setting is the investigation of the experimental use of lithium carbonate treatment to treat amyotrophic lateral sclerosis, or ALS. ALS is a rapidly neurodegenerative disease that causes weakness and atrophy, with a median survival from symptom onset of 2 to 5 years. A small, single-blinded study showed that lithium carbonate treatment was potentially efficacious in the treatment of ALS. Despite clinician skepticism, patients were understandably enthusiastic to try this treatment and began taking the medication off-label. Patients used an online spreadsheet to gather their data, and patients like me built a lithium-specific data collection tool for the use of their 348 lithium-taking ALS patients in their community. Researchers analysed the data collected by the patients and attempted to overcome the potential biases created in the absence of randomisation, blinding, and placebo control. The authors used a matching algorithm to match 148 eligible for analysis participants to 447 controls using historical data collected on patients like me. Lithium carbonate treatment was found to have no effect on ALS disease progression. The authors acknowledged that this study method is not a substitute for double-blinded randomised controlled trials, but the outcome of this study was later replicated in RCTs.